Poor hip mobility is a major factor in knee, hip and low back problems, and in this video we will show you the best exercises to unlock the full potential of your hips. If you want to squat deep, lift stuff from the ground, even do deadlifts without your lower back taking all the heat, or you want to move swiftly and gracefully, change directions without your knees and hips paying the price, then you need great hip mobility. We recommend you try all of these exercises. These exercises hit all the major angles that you need to mobilize and get mobile and flexible again. But a teaser has to be left here. The two most powerful mobilization techniques for the hip are in the end of this video, and the last one is the king of hip mobilizations, so stay tuned. But try all of them and see which ones are most important for you and which ones hit your personal individual mobility issues in your hips. Don't do these exercises if you have a labral tear in your hip, or you've been in a hip surgery lately, or you have a hip replacement. In these cases, contact your doctor, surgeon, or your physical therapist and ask them if you can do these mobilization exercises. And avoid doing these exercises also if you have any other reasons why you shouldn't mobilize your hip joint. First, we'll open up your internal rotation. This is an overlooked movement. You need internal rotation when you change directions, when you twist, when you turn. For example, in golf, you need internal rotation. You also need it in Brazilian Jiu-Jitsu, in the arts where you kick. Also, you need internal rotation. And the more you have rotational reserve, the less you go into the extreme positions and you don't strain your hip joint as much if you have the reserve. Skip this and the next one if you have gluteal tendinopathy, because this might strain the tendon in the wrong way, but concentrate on the exercises that come afterwards. So sit on the floor, back against something, for example a wall. And if you can't sit on the floor, then don't worry, we'll show you another version suitable for you. Just stay tuned. And bring your knees into 90-degree angle and then spread your legs a little bit, and then with your hand bring the hip into internal rotation. Bring it to the first sensation of a stretch. We want the muscles to slowly start to relax. If we push it to the max, the muscle will start to tense up in order to protect themselves and the joint. So slowly push it to the stretch and do this 1 to 2 minutes per side. And one tip here, spread your legs so that when you bring the knee inside, it doesn't go into a abduction, so it doesn't come over the center line too much. And no pain should be felt here when you are doing this exercise, nor should you feel any discomfort afterwards this. So do it slowly, do it carefully, and don't push it too much. It will start to relax and mobilize with this gentle style. If you can't sit on the floor, then you can do this sitting on a chair. You have to use a broom handle, a stick, and put the broom handle from the outside of your thigh to the inner side of your ankle, and then twist your hip so that the internal rotation starts to stretch. And don't stretch it too hard. You can also use a towel between the stick and your thigh so it doesn't hurt that much, and do a gentle mobilization for 1 to 2 minutes. The second mobilization targets your external rotation, and as with the internal rotation, you need this when you twist, turn, change directions, or take a triangle choke in Brazilian Jiu-Jitsu. And if you want to go into some of the yoga positions and you want to be the best at yoga, then you have to get this external rotation going for you. And also the same applies here. The more you have it in your reserve, the better you are off. Lie on your back, put your ankle onto your knee. Now start to gently push your knee or your thigh so that the hip goes into external rotation. Again, not too hard. If you can't reach it, then you can use your foam roller to push it. Also, if you feel that your pelvis starts to compensate and you start to rotate away from the floor like this, then you can do it against the wall. So you put your leg that is on the floor now against the wall and then do the same exercise here. It's easier to stabilize it in this position. You can also try a different abduction adduction angle, so you can bring your shin more across the other knee or less and do the exercise there. Check which one feels best for you, which feels the tightest but not painful. But if you get a pinching feeling in your hip, in your groin, then you need a heavy resistance band. So grab a heavy resistance band, attach it to something sturdy, for example your sofa's leg, and then pull it tight and put it around your thigh as close as you can to your hip joint and your groin. Slide yourself a little bit away from the other attachment point from your sofa so you get the nice pull to your hip joint. This creates space in the hip joint and there should be less or no pain and no pinching feeling in your groin. So now do the same external rotation. If this helps, then pick this version of the exercise. Third one is abduction mobilization. This one is also common. People stretch their adductors. This movement direction is really important if you run and do fast sprints and directional changes and you do fast cuts to the side. You need this abduction mobility. And again, the more you have this in your reserve, the less you strain your adductors and or your hip joints. Here, an easy way to do this questionable looking exercise. No, this isn't OnlyFans. This is just one of those get over it and just do it stretches. Put your knees as wide apart as you comfortably can with a slight feeling of a stretch. Then start to lean forward and then backwards. This will target different muscles and give a better overall mobilization for the joint. Do this 1 to 2 minutes. And remember, there has to be a slight feeling of stretch or a moderate feeling of stretch, but nothing too intense. We want the muscles to ease up and relax. If the sensation of the stretch starts to fade away, then you can go deeper into the stretch, but don't make it too intense. Keep it light to moderate for the best results. Next we go to the heavy hitters, and the first one is the hip extension. If this is limited, you will compensate it from your low back, and this will increase the strain on your low back and even increase the tension on your nerve roots if you have underlying spinal problems. And you need this extension when you're running, when you're walking, when you're swimming, so you need it a lot. The base for this is the posterior pelvic tilt movement. This will stretch your hip flexors, which often limit this movement. But if the muscles are mobile and flexible enough, which to be honest, for the most of us is not the case. But if it is, then this will mobilize also the joint. But it doesn't matter if it hits the muscles or the joints. If it restricts the movement, it needs to be dealt with. So put something under your knee so it won't hurt. Then take this lunge position, the please marry me position. From here, start to do posterior pelvic tilt. So you're rotating your pelvis backwards, and this creates extension from the hip. The hip extends in relations to the pelvis. So you can imagine that you are tucking your tailbone, your coccyx, between your legs. And this movement will stretch the hip flexors and extend the hip. And if you don't know how to do this pelvic tilt, this is impossible for you, then we have a step-by-step tutorial guide for this. Check it out, the link is here up, but please, for the algorithm's sake, do it after this video. And do this 1 to 2 minutes, and no pain should be felt. And also keep it light to moderate. We want the muscles to relax. If your knees hurt, you cannot put the knee on the floor, then you can do this standing up. Put your knee on your sofa or on your bed or on the chair, and now you're standing up. There's not as much weight on the kneecap, and then you do the same posterior pelvic tilt from this position. So tuck your tailbone and rotate your pelvis or tilt your pelvis. Yes, very, very smooth. Now for the best bang bang for your buck exercise, the hip flexion mobilization. This movement, the hip flexion, you need it. You need it a lot. This is a royal movement. So when you go down to squat, if this is limited, you cannot go down. You compensate it with your low back. You need this when you lean forward. You need this. This is a really key movement. And in fact, it was studied that people who have FAI had the most correlation to their symptoms and pain with limited flexion movement. So this correlated more with the symptoms than other movement directions. To deal with this limitation, go on your back. Put the resistance band high around your hip, like in the exercise before. The other end goes around your foot. Then push the feet straight. Now this pulls your hip joint and creates a glide to the femoral head in the hip joint. And now start to pull your knee towards your chest, and without pain, only a sensation of stretch should be felt. Do this for 1 to 2 minutes. You can also see how close to the center line you can do this comfortably. The more center, the better. If it's really bad in the center, then you can go a little bit into abduction, so away from the center line. If the band is too long, you can wrap it around twice. Get in contact with your engineering mindset, the little engineer inside of you, and figure it out. In this exercise, you can also use a towel between the resistance band and your thigh. This softens the touch and is more comfortable to do. So pick this one if this feels good. Remember that joints and muscles aren't the only thing limiting your movements and your mobility. Myofascial tissue can also hugely limit your flexibility. It can keep your muscles tensed up and limit the joint movements as well. So we have created a guide to unlocking the anterior and posterior myofascial chain. It's an ebook thing that you can download on your phone, on your computer. It's totally free. Go grab it now. The link is up there and in the comment sections pinned to the top. From these exercises, pick the ones that target your individual mobility issues. You don't have to do them all. Do these until you've reached your mobility goals, but usually it takes 2 months to get significant improvements. Everything is individual. It depends on the starting point of your journey. Also, if you're in a hurry and you can't do these every day, then 3 to 5 times a week is also okay. Remember to grab your myofascial release manual from there, and watch also our other videos. The topics are super exciting. And have a nice day, evening, morning, night, whatever. Have a nice one. Bye bye.